This is the last of the mini lectures for this week. The healthcare system, external forces, international comparisons, and summary and wrap up. I'm going to discuss some of the external forces that impact on how healthcare is delivered in this country. Then I have a brief summary of how to access the data for Assignment 1. I've posted Assignment 1 in the assignment sections of the course. We're going to have these over the course of the semester related to demographics, health and healthcare professionals, and so on and so forth. You should pick one county in the country and follow it all the way through, using it for each assignment. It can be from any state in the Union. You might even want to pick more than one for your own interests if you want to compare urban and rural, rich and poor, and so on, but that is not a requirement. No industry exists in a vacuum. This diagram from page 10 in the text illustrates outside forces that impact on healthcare. During the course of this semester, we will refer back to it many times. It will help us to understand and possibly to predict changes within the industry. This understanding is a crucial sixth sense for successful administrators and managers. For example, here are some current events and trends that should be on our radar screens. Social values and culture. We are becoming more and more a multicultural society with diverse ethnicities and subcultures, all of which may have different perceptions of healthcare and different needs. Political climate. The politics of stem cell research will have a major impact on the search for cures and the growth of the bioengineering industry. Economic conditions. Employers are paying smaller and smaller portions of health insurance for employees, responding to and creating economic conditions that determine access to health care. Technology. We constantly learn of new technology, such as RFIDs or implanted radio frequency identification chips with health information, that may be effective and useful but raise questions about ethics and privacy. Physical environment. In 2005, we saw a powerful example of how the physical environment can devastate the healthcare sector of a major American city, New Orleans, with ripples and implications for hospitals in Houston, Little Rock, Jackson, Mississippi, and others. And finally, the population characteristics. In contrast to the situation in the 1950s, when a hospital and staff were enough, administrators today must be acutely aware of the demographics, risk factors, tastes and preferences of the populations that make up their service areas. A hospital or ambulatory care center in Southern California has a much different patient base than one in the Rocky Mountains or the Mississippi Delta region. The guidelines for Assignment 1 are pretty self-explanatory, and I'm going to walk you through the web pages. The first database that we're going to use is from the Census, uscensus.gov, and we're going to go to the Quick Facts site. So that starts on the next slide. As you can see, right here in the left column, I've got a red arrow there, and I put this up in color so that you can see where I've highlighted things more easily, but you can print out the handouts in black and white if you like. You want to go to the Quick Facts, and if you're interested, you might play around with using a map to pick a state or whatever. I think that once you get into the county level, you can even use the map to look at the demographic data and the economic data. Okay, I have skipped through the page where you select a state because I just selected Arkansas, and it's going to give you this select a county button, and you'll see that it gives you things on population, things on race, and as you scroll down when you get to the web page, you'll see that it gives you much more information on that county. Now, what you might want to do is look at a few counties and see which one interests you. Just don't pick something you're familiar with. You might pick somewhere in New Jersey or somewhere in Washington State just to get a sense of what's going on in the rest of the country. Some good metropolitan statistical areas, large ones, are St. Louis, New Orleans, Chicago. If you're interested in looking at urban areas, there are going to be more healthcare professionals in urban areas, as we'll see later on when we get to the other assignments. So you might want to even pick one rural and one urban, as I suggested before. But for this assignment, you only really have to find one. You can pick the city and then go back and get the county that that city is in. I neglected to point out in the previous slide that it compares the demographics for Arkansas to the country as a whole. And so when I clicked on Select a County and selected Pulaski County, Arkansas, it compares Pulaski County to Arkansas as a whole. If you want to pick certain demographic variables and compare them to Arkansas and the country as a whole, you've got it all here right in front of you in just those two web pages. I'm going to talk just briefly here about the three primary forms of health insurance or healthcare systems that are mentioned in your textbook. And of course, as you would expect, there are many different permutations of these main forms in many different countries. So I want you to be sure that you read through this section of the textbook and look at some of the permutations among even the countries there under each of these topics. National health insurance and a nationalized healthcare system, people often get these terms mixed up. In fact, people often take all three of these terms and lump them into the idea of socialized medicine, which is kind of held up as a nightmare system that we don't want to get involved in this country. And that's what some of the opponents of the Affordable Care Act have used as a scare tactic, the idea of socialized medicine. So anyway, the first one is national health insurance. The example that your textbook uses is Canada, in which the government assumes the financing, payment, and insurance functions, although the financing is really technically accomplished by a general tax on the population. The term global budget, which you will see applied to both the national health insurance systems and national health systems, simply refers to a budget determined in advance to cover the healthcare needs of the population for a projected period of time, adjusting for trends over time. It's not really different at all from what insurance companies do. It's simply called a global budget because it is done for the nation as a whole. In a national health insurance system, the government does not assume the provider role. It simply reimburses both public and private providers. The Canadian healthcare system is sometimes held up as a model for equitable healthcare that reduces disparities and increases access to care. However, in recent years, the costs have increased dramatically, and private insurance companies are beginning to appear. In a nationalized healthcare system, such as Great Britain, the government provides all functions: financing through taxes, insurance, payment, and provision of healthcare services. However, what is often omitted in descriptions of this system is that Britain actually has a tiered system. Effectively, maybe not formally, but effectively it does have a tiered system, with some private insurance companies and private practice physicians providing care to those who can afford it. Interestingly, even in Great Britain, with the national healthcare system, or National Health Service, healthcare status of the population varies by social class. British birth certificates have traditionally listed the father's occupation, but not the race of the child. Longitudinal studies have shown repeatedly that those with a higher class ranking by father's occupation at birth have better health even in adulthood. This raises the question of whether a nationalized health system can eliminate all disparities or all health disparities. It also points to the fact that whether you look at class or race or income, there is a disparity across gradients. Finally, socialized health insurance includes mandates that all citizens have coverage. However, care is provided through private providers financed through sickness funds, and the example that your textbook uses is Germany. Each of these systems has significant advantages and also disadvantages. Please read the brief description in your textbook on the countries covered to get a more in-depth understanding of these variations. One of the most striking things that I see in all of this is how many countries with varying types of healthcare systems, not just the United States, are seeing the impact of rising costs and economic recession. In conclusion, how to learn the system. Concrete facts such as numbers of hospitals, size of the workforce, types of professionals, methods of care, technology, new and old, the history of the industry. You will find that there are many facts to learn in this course, from new definitions to acronyms to rates and ratios and financial information. With careful attention, you will become an articulate insider in 13 short weeks. Some questions that will help you understand the next three components. Who is involved in running the system, if it is indeed a system? Who are the players? Who has influence? Who creates demand? Who uses the product? How does the product differ from that in other industries? Who has the power and who doesn't? The money. What is the healthcare marketplace? Does it exist as a true marketplace? What does healthcare cost? Who pays for it? Where does the money go? How does the money, the economic cycle, the insurance industry, the federal government impact on the system? What are the methods of interaction, formal and informal, between the players? What laws, regulations, lobbying activities, consumer characteristics interact to produce the system we see today? What is the impact of outside forces? Who has power and how is power shifting? Just as in learning tennis or a foreign language, as you master the pieces, the big picture will become clearer and clearer. At times, it may seem that you can't see the forest for the trees, but stick with it. Take time to reflect on these questions, and your focus will broaden and deepen. That's it for this first lecture. Please email me if you have any technical problems with this lecture or if you have any questions at all.